Hi guys, welcome back to Be Well Informed with me, Dr. Sarah. I am so happy to have you here. This is our second episode of Be Well Informed. And before I even get into it, I just want to say a big thank you to my day ones, the people who subscribed and viewed the first episode from last week. I am so grateful. I received your messages, I saw the comments, and I was overwhelmed with gratitude, the words of encouragement, and I just felt very loved in this space. And so, thank you so much. Thank you for trusting me and joining this journey together of being well informed with the hope that we shall truly be well. So, for the first episode, we are going to talk about a symptom, and that symptom is chronic fatigue. It's not a condition, it is a symptom of an underlying condition. And there are three common conditions that could be causing chronic fatigue. But before I go any further, let me first define what chronic fatigue is. This is basically anyone who is feeling tired all the time. You sleep and you wake up and you still feel like you didn't quite fully rest. It's 3 hours later in the day and you're just tired. You feel like you need to rest some more. You're just consistently tired. That is what I mean by chronic fatigue. And there are three common clinical conditions that could be causing that chronic fatigue. And that's what I want us to cover today. But before we go into the clinical reasons why you may be experiencing chronic fatigue, I want to address the number one cause that I believe is plaguing our society and leading to the state of fatigue we're all in. That is the lack of rest. And by rest, I don't mean more sleep. I mean finding routines and behaviors that get us into a state of physical, mental, and emotional rest. We are living in a society where everything is go, go, go. We are constantly getting alerts and notifications, whether it's from WhatsApp, calls. There's just so much overstimulation. Whether it's your phone, and primarily the phone and the digital space, including this one. And we have gotten into that routine of constantly receiving information or being entertained through these screens, right? And what that does is that we're constantly on the move or constantly being overstimulated, and we have forgotten how to rest. Now, rest means being able to do a routine, whether it's exercise, whether it's a hobby like a sport, baking, just sitting at the garden or at your balcony and looking outside, taking a walk in the forest or in your local park, yeah, and just taking in the fresh air and finding a moment to release all the thoughts, all the emotions, and be in a space of complete rest. That's what I mean by rest. And we are forgetting to do that on a daily basis or at least a weekly basis, finding the routines of behaviors and activities we can do to rest. That is the number one cause of chronic fatigue in our society. So I challenge you all to take a moment and reflect. When did you last rest? Because if you're not resting, you are probably in a state of chronic fatigue right now, or it's just about to hit you. Okay? So please, number one thing, it's not your body, it's not a disease, it is your lifestyle. So let's start developing a lifestyle of rest. If you want me to talk about that more, I can do that in a separate video. So now let me get into the medical conditions that could be causing chronic fatigue. And today I'll only talk about three of the most common conditions that could be causing chronic fatigue. Number one, your iron levels are lower than you think, right? So when your iron levels are low, you get what we call an iron deficiency anemia. There are very many types of anemia, but this is now specifically iron deficiency anemia. So iron is basically a key micronutrient used to help build your red blood cells and the hemoglobin in your body. Hemoglobin is a part of your red blood cell that helps carry oxygen around your body. When you lack enough oxygen, that going to all your organs, especially your brain and other key organs, you end up feeling fatigued. So that's the chain, right? Low iron, low hemoglobin, low oxygen supply equals chronic fatigue. In addition to the fatigue, you may have other symptoms. So one of them could be breathlessness. At distance, you'd walk very comfortably. You notice that you're getting breathless. You find yourself getting very breathless. Another thing is your heart. You may be aware of your heartbeat. And so your heart is beating faster. You're getting palpitations. And you're just wondering why I'm not feeling anxious, but your heart just is beating quite fast and you're aware of it. The other thing could be your nails. You notice some bodily changes. Your nails are getting brittle, your hair is changing. That could be a sign of low iron deficiency, or rather iron deficiency. Another could be cravings, awkward cravings like dirt and clay, especially now in this rainy season. When you smell the rain and you smell that muddy smell, you start craving that taste. And that normally is your body telling you it's craving a couple of micronutrients, but commonly iron. And so that is those are some of the symptoms, in addition to fatigue, that could mean that you have iron deficiency. So if you're experiencing any of these, you'd want to go to your doctor, and they would probably recommend a simple blood test. The blood test is called a full hemogram or a full blood count. Basically looks at your full blood panel, which includes your red blood cells and your hemoglobin levels. And when your hemoglobin levels are low, the other parameters they look at to just tell, is the hemoglobin low because of low iron? And when they look at that, it's most likely an iron deficiency anemia. Your doctor may also recommend other tests beyond that full blood count to now identify why is the iron low, right? Is it low because you're losing blood from somewhere? Is it low because you're not taking in enough iron, or is it low because you're not storing enough iron? So those are like second level tests that your doctor would do. But the moment they just do that full blood count, they'll be able to tell this is an iron deficiency anemia and start treating even as they investigate what other reasons you have low iron, right? Once you do that test and it's confirmed that you have an iron deficiency anemia, the treatment is pretty straightforward. It's just to get more iron in your body. And that could be through iron supplementation or even just some dietary changes that you could take to just increase the amount of iron in your body. And once you do that, you should do follow-up blood tests, and you will notice the change in your hemoglobin going up, and you should feel much better. The second reason that you could be feeling fatigued is because of your thyroid gland, an underactive thyroid. Now, the thyroid gland is a gland in your neck. And this thyroid gland, is responsible for managing your body's energy levels. So if you have an underperforming thyroid or an underactive thyroid, medically termed hypothyroidism, you will find that you have lower energy. And this is the fatigue you feel. You may also find that you're gaining weight without any change in your lifestyle, so you have unexplained weight gain. You may find that you have constipation, which is like a sign that your body's digestive system is just moving slower. And when it moves slower, you get constipated. You may experience dry skin, like your skin just feels drier most of the time. Some of the other symptoms you may feel is cold. You may find that you get colder than anyone else because your body isn't generating energy, and so your metabolism is lower, and so your own thermoregulation is not where it should be, and so you're feeling colder than other people. And then another reason you may have is just feeling foggy. Your brain is foggy, like you're either you don't have the clarity that you used to have. You're either not necessarily like forgetting things, but just yeah, like your train of thought, that groggy feeling you feel when you just woke up. Exactly that fogginess. And so those could be other signs, in addition to the fatigue, that you have hypothyroidism or an underactive thyroid. If you have any of these symptoms and you go to your doctor and explain that to them, they may consider doing a thyroid function test. That is like the diagnostic test to just check on your thyroid. It looks at the different panel of hormones in your thyroid, and if it comes out back that the hormones are low, that is how you diagnose hypothyroidism. And again, the treatment is pretty simple. Your doctor will most probably give you just a medication to replace that hormone that is low. And for people who have hypothyroidism and start the medication, it is night and day. They feel so much better. Their energy gets back up. They feel like their normal selves again. And so it is life-changing. So hypothyroidism is a condition that could cause chronic fatigue, but again, is easily tested and treated. So reach out to your doctor if these symptoms feel familiar, and they'll be able to guide you on the next steps. And now, number 3, the third reason that you could be experiencing chronic fatigue is because you have a condition we call sleep apnea. So sleep apnea is when your airway constricts and completely blocks while you sleep. And so when you're sleeping, your airway blocks and your brain has to wake you up so that you start breathing again. And you won't remember that you woke up. It's just a natural instinct for survival that your body does, and you wake up and then go back to sleep. And so why this really causes chronic fatigue is because it happens repeatedly overnight. So you're sleeping, your airway gets blocked, your brain wakes you up. It happens again. You sleep, brain wakes you up. So you're constantly being woken up because of this constriction of the airway, and you're never getting into deep sleep. So you're just consistently having shallow sleep where you're being aroused and woken up, but not getting into deep sleep. And so you have poor quality of sleep, even if you have a lot of quantity. So you could be sleeping 8-10 hours, but because of the quality of your sleep is being interrupted by the frequent waking up due to sleep apnea, you feel chronically fatigued. And so one of the symptoms, a couple of symptoms are related to sleep apnea. If you have sleep apnea, you tend to snore. You snore a lot. Your partner could notice that you stop breathing in the middle of the night. So if you have a partner or someone who sleeps in the same room with you, they would notice that you stop breathing and then you keep getting startled and waking up. That could be a sign that you have sleep apnea, some of the symptoms around sleep apnea. There are also other risk factors such as weight gain. If you're gaining weight, if you have a family history of snoring, those could all be factors that make you more likely to have sleep apnea. So if you suspect that you have sleep apnea, you would need to talk about this with your doctor, and they may recommend a sleep study. A sleep study is really the only practical way you can diagnose sleep apnea, because there needs to be an observation and monitoring of you being asleep and seeing if your airway remains patent, remains open as you sleep. And there are places that you can do sleep studies here in Kenya, and I'm sure other parts of Africa. And you just need to get that test. They would monitor it, and they would be able to diagnose whether you have sleep apnea. If you do have sleep apnea, the treatment is not a pill like the other two conditions I shared. For this one, it's actually a machine called a CPAP machine that you would have to wear or put on as you sleep. And what it does, it helps maintain keeping your airway open. So avoiding that spontaneous blockage of your airway, and therefore keeping your airway open, which allows you to get into deep sleep and have complete rest. For patients who have sleep apnea and get the treatment with a CPAP machine, they say it's the best thing that happens to them. It is completely a life changer because they suddenly go from not having enough rest to just getting such good sleep, and they feel rested and refreshed and wake up, and the chronic fatigue slowly fades away as they get their quality sleep. Okay, so those are the three medical reasons on why you would get chronic fatigue as a symptom. Number one is low iron or iron deficiency anemia. Number two is an underactive thyroid or hypothyroidism. And three is poor quality of sleep due to sleep apnea. There are so many more conditions, and that is why you need to talk to your primary healthcare doctor to speak about the symptoms, because chronic fatigue is just one symptom. When you put it together with other symptoms, it gives clarity to the doctor on what could be going on. Also, as I mentioned at the beginning of the video, evaluate your practice of rest, because that is the biggest problem that we have as a society. So guys, I hope you enjoyed our first medical conversation here at Be Well Informed, and I trust that as you continue to be well informed, you shall truly be well.